Hi, everyone. My name is Susan Livingston, and that was my dancing husband, Jeff. Thank you for being here today. I'm so happy to be talking to you. What we're going to talk about today is different insulins, and I'm telling you, as a nursing instructor, this confuses students so bad, and it really is not that hard. Could you hear the words rapid acting insulin, short acting insulin, intermediate acting insulin, long acting insulin? And you were like, I'm so much. No kidding. Like, look here. Look at all these insulin. Look at all of them. And you're going to be giving them. And that can hurt somebody, could kill somebody if you don't know what you're doing. Okay, so sit back. I'm not sure how long this is going to take. And let's get unconfused about insulins. Okay. I want to show you this. There are many types of insulins that a nurse needs to know. And what they all have in common is that they lower blood glucose. That's what insulin does, is lower your sugar. And it's funny because some nursing students think insulin raises sugar. No, 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 no. Insulin lowers sugar. That's what they all have in common. Every one of them is that they're going to decrease your sugar for diabetics. But how they differ is on the onset of action. And that means when they start to lower your blood sugar or begin to work. They also differ in the peak action, which means when they really lower your sugar or they're really working the strongest. And then they differ in the duration of action, how long they're going to lower your sugar. But they all lower sugar. And this is what we're going to talk about today, is the onset, the peak, and duration. Now I'm going to show you this chart. I'm going to put it all up here. At the end of our lecture, this is what we're going to cover. But right now, that's too busy. That's too much. We're going to take it all away, and we're going to start to bust this down, and we're going to get unconfused. Okay. In this column here are the names of our insulins. Insulin Lispro, Aspart, Glargine, Detamir. The next column is the type of insulin, and that's where we hear rapid acting, short acting, intermediate acting, long acting. Over here, the appearance of it. When you look at it in a vial, can you see through it? If you can see through it, it's clear. If you can't see through it and it looks murky, it's cloudy. Okay? And that comes into play when you want to take two different insulins and mix them together. And that's another topic altogether. We're not going to talk about that today. Here's what's the most important, right up in here. The onset, the peak, and the duration. And let's take a peek here. You can see when this really starts to lower your blood sugar. Look how fast that works. If I give this an insulin at 8 a.m. in the morning, it can start to lower your sugar 15 minutes later by 8:15. That is a rapid acting insulin, and I'll explain that in a minute. If I give it at 8 o'clock, it's peaking and it's really dropping your sugar, really dropping it between 9 and 10. Okay? You've got to watch out for that time because it's really lowering sugar, and that's when the patient can get hypoglycemic, start exhibiting symptoms of low blood sugar, possibly pass out. And a nurse has to know. She has to know that peak. She has to know the onset too, and we'll talk about it. And the duration, if I give it at 8 o'clock, it's going to hang around until 11 a.m. or 1 p.m. And then it's out. It's gone. Okay? And those are the rapid acting insulins. And I'll give you a tip here in a minute on how to remember that. Now, the short acting insulins, if I give it at 8 o'clock, it's going to start to lower sugar around 8:30. So about 30 minutes after I give it. It's going to peak around 10 to 12. 10 a.m. to 12 p.m., and it's really lowering my sugar then, and the patient can get hypoglycemic, and that's the danger zone. Then it's going to hang around until 1 p.m. to about 4 p.m., and then it's gone out of my body. Now, I know in school so far, you've probably learned a little bit different time ranges in here. That's okay. NCLEX is not going to be precise. What we all agree on, though, is the onset. And we all have general ranges about the peak and the duration. Now, if you get into the intermediate acting insulins, and I give it at 8 o'clock, it's going to start to lower my sugar between 10 and 11 in the morning. Then it's going to peak and really drop my sugar between 12 p.m. and 8 p.m. My gosh, that's in my body a long time, really lowering my sugar because it works over time. And then it scoots on out of my body between 10 p.m. and 2 a.m. So you can see when it says intermediate acting, it means it's going to work over a longer period of time, but it does not work all day. Okay. Now the final one is our long-acting insulins. And if I give it at 8, it shows up to work about 10 o'clock in the morning, but there is no peak at all. It's just there saying, hi, I'm here to lower your blood sugar, and I'm going to slowly lower your blood sugar throughout the day, and I'll do it all day long. And that's long-acting insulin. Okay, so come over here, erase all of this. Let me give you some little tips. Insulin Lispro, insulin aspart, and insulin glulisine are rapid acting. They are the fastest acting insulins out there. And here's your tip. Insulin Lispro. A pro or professional works faster than an amateur. Insulin aspart. Now don't get mad, but I have to say it. Students need these tips. Get off your ass now. Aspart. Like, get off your ass now. And insulin glulisine, and glue dries fast. So insulin Lispro, insulin aspart, insulin glulisine. Then you go down to, you got regular insulin, and that's just regular insulin. But you get down here to the intermediate acting insulins, and you get the real long names. Isophane insulin suspension, also known as NPH, and isophane insulin suspension and regular insulin, 70/30. Now, let me bust that down for you. I, in the isophane, I for intermediate. Those are going to be longer acting insulins. And when you see the word suspension, a nurse should know that that means there's more than one thing in that container, and it's cloudy, and it's a mixture of things, and that's going to have to be rolled between the palms of your hands for you to mix two things together. Isophane insulin suspension and regular insulin, 70/30. So it's got this in it plus this together. So you're going to have two things in the vial together that make it cloudy, and you're going to have to roll them together. And what 70/30 means is you've got 70% of the intermediate acting in that vial and 30% of the short acting in that vial. Then we get down to the long acting insulins, insulin glargine. And GLAR, G-L-A-R, looks like the word glare. And like when you're mad at somebody and you glare at them a long time and you don't want to take your eyes off of them, you're glaring at them. That's insulin glargine. It's a long-acting insulin because you glare a long time. And insulin detamere. Detamere sounds like a year, and a year is a long time. Now, here's where I'm going to get a little unconventional, a little unorthodox, but I have to do it. Students are always begging for tips. They're always begging for tips. They need tips. They need tips to help them stay safe with these dangerous drugs. And I want you to think right now, let's say we're women, and these represent the men that you like in your life. Or if you're a man, they're the women that you like in your life, or whoever you choose to like. And here we go. I want you to think, um, let's name this guy here, up here. Let's name him Steve. And Steve, he's fast acting. He's known as my booty call or my hit it and quit it guy. Okay. Which means if I call him up at 8 a.m. and he's working on his car, and I said, "Hey, Steve, you want to come over? Come on. Come on. Now's the time." He will say, "I will be right there." He will slam the hood of the car. He will go clean up, and he'll be over to your house at 8:15. And then by 9 to 10, you and Steve are really having a good time, if you know what I mean. And then he's gone. He's gone by 11 or 1 because he's just your hit it, quit it guy. He's in, he's out. Okay. And we don't like each other that much. We have fun in a certain way, but we're not going to hang around together a long time because that's not what we're about. Okay. So we go over here and we go to regular insulin. We'll name him Bill. Now, Bill is my friend with benefits. Now, I like Bill and Bill likes me, but we have a little something on the side too. So if I call Bill at 8 o'clock in the morning, I say, "Hey, Bill, you want to come over?" He said, "Well, I'm working on the car. Let me go take a shower and I'll be right over." So I call him at 8. He's over at 8:30. And then we're really having a good time, my friend with benefits, from 10 to 12. And he likes me and I like him. So he hangs around until about 1 or 4 o'clock in the afternoon. "Thanks, Bill, because I like you too." Then we get over here to the long words, the ones with isophane in it. Those are the intermediate acting insulins. I'm going to name, just trying to keep a name short, we'll name him Jim. Now, Jim is my actual boyfriend, and I love Jim, and Jim loves me, and he's going to stay with me a while. He's not going to stay all day though, but he'll be with me a while. So if I call Jim's at 8 o'clock, and he's working on his car. I said, "Hey, Jim, you want to come over? I missed you." And he said, "Yeah, baby, I'll be over. Give me about 2 or 3 hours to wrap up what I'm doing, and I'll be over." And when he'll get over to my house around 10 or 11. He didn't come over at 8:15 like Steve did, but he's there around 10 or 11. And then look how long we're having fun together, me and my boyfriend, uh, Jim, because we like each other. And we're really having a great time together between 12 p.m. and 8 p.m. at night. And he'll hang around a little bit after that too. We might fall asleep together, but he'll scurry out probably about 10 o'clock at night, 2 o'clock in the morning, and I'll see him later. Well, let's go to the long acting. The long acting insulin, glargine and detamir, that's like my husband. No, I'm not going to say my husband, Jeff. We'll say Paul. Now, I've been married to Paul for 30 years. So if I call Paul and he's at work, I say, "Hey, Paul, you want to come home? Come, see if you can take the day off." He said, "Oh, honey, I called him at 8. He said, "I'll be there in a couple hours. Let me wrap up what I'm doing on my desk, and then I'll be over." And I'll come home. And then when he comes home, he just sits on the couch, watches TV, watches the racing channel, pulls out a beer, and he's just kind of there because we've been married 30 years, and it's just kind of there. And then he never leaves. He's there for 24 hours a day. That's my husband, Paul. So if you can think of the insulins this way, as your booty call, your hit it and quit it insulins, insulin Lispro, insulin aspart, insulin glulicine, you will know it comes in quick, does its job, and gets out. Regular insulin, friend with benefits, going to show up just a little bit later, hang around a little bit longer, and then scurry on. Then the isophanes, that's your boyfriend. He'll be over a little bit later, not too long, but 2 or 3 hours later. Hang around a long time. Not all day though, because you all really like each other. And then your boyfriend. your husband, he'll show up in a couple hours and just hang around all day and just never leave. So those tips are what students beg for. They beg for something that's going to make it click, because I've had lectures by teachers on this stuff before and it just goes right over my head. I remember that in school. So hopefully this will help you a little bit better. Now here's a little, some things to remember. The rapid acting insulins, insulin lispro, insulin aspart, insulin glucine. Let me step out of the way here. These are given before meals, and nurses and patients give shots before meals of insulin. And because if you're going to eat, your sugar's going to go up. So if I give you a shot of rapid acting insulin before you eat, it's going to help lower the sugar that came up after your meal. Since these work so fast, within 15 minutes, they're starting to drop your sugar. You have to have the meal tray right in front of the patient. You cannot give that shot and pray the meal trays come up on time, because sometimes they are delayed. So if it's time to give the insulin, but the trays are not on the floor, you hold that shot. Because if you give that shot and he does not have that food right in front of him, his sugar will start to drop and he might pass out before breakfast gets here. And it can be used for sliding scale insulin, and you'll hear that in another discussion. The regular insulins, they work pretty quick too, not as quick as the ones up here, but they're given before meals too. Now you can give that before the meal tray is here, because it's not going to start working for 30 minutes. So if the meal trays are slightly delayed, it's no big deal. Go ahead and give it. The meal trays will be up momentarily. It's the only insulin that can be given IV, intravenous, for like diabetic ketoacidosis, and it can be used for sliding scale. Now the intermediate acting insulins, as I said, they have 2 substances in one vial, and that makes them cloudy. So before drawing them up in a syringe, you have to roll the vial between your hands to mix the 2 ingredients. It can be given twice a day. That's it right down here. It can be given in the morning, and then it can be given in the evening, because it doesn't work all day long. So it works this much, and then you pick up and get another dose. You can also, if you give it at nighttime, you better provide a nighttime snack for that patient. So when it's peaking in the middle of the night, his sugar doesn't drop. The long-acting insulins, they cannot be mixed with any other insulins. They're an individual injection all by themselves, and we'll explain that in another topic. Since there is no peak at all, just lowering your sugar slowly over the whole day, it can be given at nighttime, because the patient is not, their sugar's not going to plummet, because it's just slowly lowering your blood sugar over the day, and you don't have to worry about a blood sugar drop in the middle of the night. Now, most people are on a mixture of insulins, like most diabetics, be giving a rapid acting or short acting insulin before all meals, and then probably have an intermediate acting or a long acting insulin with that to give them full day coverage before every meal and all throughout the day. So if you can remember these things about these insulins, you can feel a lot happier, be a lot safer on the floor giving them, and you don't have to worry about injuring or endangering your patient. So thank you guys for being here. See you next time. Thank you.